Welcome to the fourth part of ovarian lesion, and today we're going to continue the ovarian lesions we're likely to see on ultrasound. We have talked before about the ovarian tumors. We have went through how to diagnose the ovarian tumors and the PCO appearance and the PCO syndrome. Now we're going to talk about two other more confusing entities or similar. But before, I want you to grab your cup of coffee, whatever your preferred method of brewing your coffee is. This is the Italian cafetiera, the mocha pot I told you about before, that's named after the port in Yemen, mocha. It makes great coffee, and it's not very expensive coffee that you can compare to the one you have from your barista in Starbucks or Dunkin' or whatever. Perhaps later on I'll tell you more about it, but today now we're going to tackle the ovarian lesions first. Okay, so we have two entities here that we have to differentiate. Okay, the first is the hyperstimulated ovary, and the second is the hyperstimulation syndrome. Remember, in the PC, we had the PCO appearance when the ovary was enlarged and has peripheral follicles, and they were small and they ranged from 20 and above, and the PCO syndrome. PCO syndrome necessitates that there is the picture of PCO by ultrasound and other like laboratory results or clinical symptoms. Here we have the stimulated ovary. This is what we would see by the ultrasound, and the hyperstimulated ovary syndrome. And similarly, here we would have other symptoms you're going to see, and here this is going to be by ultrasound. Let's see this, okay, in details and delve into the details. This is the stimulated ovary, okay? The stimulated ovary represents an enlarged ovary, okay? But here all the follicles are large, okay? She's a female patient, most likely this patient, of course a female. She complains of having many follicles, and none of them attains maturity. That's why she goes to her doctor and he gives her induction. And induction drugs that induces ovulation produces this appearance. There are many follicles that are enlarged, okay, as such, and the ovary is enlarged, okay. This is of course not the PCO appearance, because the follicles here are large. Remember, in the PCO appearance there was all the follicles was small, but here we have all the follicles are large. Look at them, they are all large. Of course, the ovary is enlarged too. And she would give you the history of having drugs for induction. Okay, look at the follicles, they are all enlarged. In contrast with the PCO, they would be small. Okay, so here we have an enlarged ovary, just like the PCO, but there are differences between the PCO and stimulated ovary. You said that both are enlarged ovarian size, okay? All right, but the stimulated ovary, and here the PCO here. Stimulated ovary, all the follicles are enlarged. So the follicle itself is large. We also here have many follicles, but they are small. Okay, In the stimulated ovary, the follicles, as we see, they are everywhere. They are in the periphery. They are in the stroma. So they are arranged peripheral and central. Peripheral and central. Okay, here they are arranged peripherally. In the BCO, we have echogenic stroma, right? Remember? Here, we don't have echogenic stroma, we have the follicles everywhere. And of course, there is the difference between the clinical picture. In the BCO, the patient has hirsutism, has abnormal cycles, or oligomenorrhea, as we have explained before. Here, the patient has primary infertility or secondary infertility, and she's having drugs for induction. Okay, so she's basically suffering from infertility, and she's on drugs. Here, she might be suffering from infertility too, but she's not on drugs for induction. So these are differences between the stimulated ovary and the PCO. Okay, and the ovary would look as such. Okay, all right. Let's see another picture as to how they look. Again, here the stimulated ovary, and here the PCO. Voila, these are the differences. Here we have multiple large follicles. They are arranged centrally and peripherally, and there is history of drug intake, and there is no echogenic stroma. Here, look at this. Look at the follicles. They are arranged in the periphery. Have here small one, but basically they are arranged in the periphery. They are small. Okay, we have the echogenic stroma, and there is history of clinical data suggesting of PCO syndrome, and we have the echogenic stroma. So this is to be crystal clear. There are side by side here, so that we know the differences between the PCO and stimulated ovary. Yeah, both have multiple follicles, both have enlarged ovary, but look at the differences. So now we know which is which. Okay. Voila. Again, the stimulated ovary. Look at the follicles. This is 3D rendering. Okay. All right. So, what about the stimulated ovarian hyperstimulation syndrome? Well, it has the appearance of stimulated ovary, but the patient would have other stuff, would have complication. Okay, these are all the complications, but to us, by the ultrasound, the complications that we're going to see that will make us suggest this ovarian hyperstimulation syndrome would be the patient having moderate ascites, because the mild ascites might not be assessed well by the ultrasound. So her having ascites, that's to say we would take a look at her abdomen and we'd see fluid between the liver and the kidney. Okay, and pleural effusion. So this would place her into even a severe degree of ovarian hyperstimulation syndrome. Okay, so if it's just in her abdomen, that will mean she's moderate complication. If it's in her lungs too, the ascites, the effusion, this would mean that she's having rather severe complication to the ovarian hyperstimulation syndrome, to her ovarian induction drugs. Okay, so this is the syndrome. So let's wrap things together now and make a sum up of both the ovarian hyperstimulation syndrome and the ovarian hyperstimulated appearance, along with the PCO and the PCO syndrome as well. Okay, okay. Here the PCO appearance, and here the stimulated ovary appearance. Okay. Here the PCO syndrome, and here the ovarian hyperstimulation syndrome. Okay? Okay. And the PCO, we have an ovary that looks as such. The ovary is enlarged, okay, and the ovary here is enlarged too. We have multiple follicles, but here they are small and arranged in the periphery, okay. They are multiple and small, but here we have the follicles are multiple, yeah, but they are rather big and they are arranged in the center and the periphery. We have here an echogenic stroma. We don't have an echogenic stroma here, okay? What about the PCO syndrome? And here we have history of drugs, don't forget this, okay? All right. What about the PCO syndrome? Here we'd have the appearance by the ultrasound and clinical data, as in hirsutism, as in obesity, as in oligomenorrhea, and have lab findings as well as in elevated androgens. Okay, 2 out of these 3 is sufficient to diagnose this. 2 out of these 3. What about the ovarian hyperstimulation syndrome? We have this basically plus her having complication as in ascites and pleural effusion. And of course, the patient will be on induction drugs. So this is basically a wrap up of the PCO and the PCO syndrome. And of course, there are people who confuse all these terms together. And whenever they see an enlarged ovary, multiple follicles, well, voila, this is a PCO. Well, no, this is not the case. There are differences here, and we have to differentiate because the management is quite different, and we have to know which is which. All right. So back to our slides here. This is the complications, as we said, that would make the patient having ovarian hyperstimulation syndrome. It would be moderate if she has only moderate ascites in her abdomen, and it would be severe if this progress as well propagates to her lungs, having a pleural effusion. Okay, all right. This is by the ultrasound. Look at this here. This is an enlarged ovary with enlarged follicles. They're arranged everywhere. So this is an stimulated ovary. Okay. Then I would complement my exam and look at her abdomen. Look at the Marston's pouch. If she's having fluid here, look at this. This is free fluid between the liver and the kidney. Well, then she's not just having a stimulated ovary, she's in ovarian hyperstimulation syndrome. So I would write this, of course, because this means she has to have immediate management, immediate intervention, has to be in the hospital or something, okay, in order to treat this condition. All right. Again, this is an ovarian hyperstimulation syndrome because I see this with the ovary. Okay, this is enlarged, it's multiple follicles that are large and arranged everywhere. And I look at her abdomen and I see this free fluid around the liver. Okay, this confirms it. She's having complication. This is an ovarian hyperstimulation syndrome. Look at this by the CT. Look at the fluid everywhere. Look at the ovaries. These are 2 here. But there are no effusion in the lung. Okay, look at this again. Okay. This is a moderate case because there is no effusion. Here, look at the claustrophrenic angles, they're clear, so there are no effusion in the lungs. Here, the ovaries, they're enlarged with multiple follicles, and there is fluid in the abdomen. So this confirms it. Okay. Okay, now there's another ovary with many follicles inside. But before attacking this particular case, let's make sure yet another time that we are gathering well all the differential diagnosis of an ovary with multiple follicles. Okay, it's essential that we know how to differentiate these cases. Okay, the first, we have an ovary here that has many follicles, okay? And they look as such. And one of them is lodged. And the ovarian size here is normal. And I have follicles as such, and one of them is large. and the ovary is normal, less than 10 cc. So I would say that this ovary is normal. Okay. All right. Another ovary here, but this one is having multiple follicles, but they are larger. Look at this. And one of them is particularly large. Again, the ovarian size is normal. So here the ovary is normal, but the follicles are, there are many follicles and they are large in size. And the female patient is a girl, okay, around menarche, like 14 years and such. So this is a multifollicular ovary. Okay. Again, I have here an ovary that is large. Okay, this ovary is large. And here I have many follicles, but they are rather small. This is essential. They're rather small, and they are arranged in the periphery. And they are multiple, around 20, and they are arranged in the periphery, and the ovary is large, enlarged. Okay, so this is what this is, PCO appearance. Okay, again, I have an ovary that is large, okay, and it has many follicles too, but they are large. They are large and arranged everywhere in the center, in the periphery. There is no echogenic stroma, and multiple follicles, and they are all large, arranged everywhere, and the patient is on induction drugs. This is a stimulated ovary. Okay, so all of these appearance, the ovary has multiple follicles, but here the ovary is normal, so normal in size, and she has some follicles. One of them is large. Okay, this is normal. Here the follicles are enlarged, but she's in the age around the menarche, and the ovary itself is normal. Well, this is the multifollicular ovary. Here the patient has an enlarged ovary, and the ovaries are arranged in the periphery, okay, and they are multiple and small and tiny. This is a PCO. Here there are multiple follicles, but they are large and they are arranged everywhere, and the patient has induction drugs, so this is the. So all of this represents an ovary with many follicles, but the diagnosis is different. So some people just might rush into diagnosis, as I told you. Well, any ovary that has many follicles is a PCO. Well, as we have seen, this is not the case. So this is the differential diagnosis of ovary with multiple follicles. Okay, now that we have settled this, we can now see this particular case. Okay, let's go and see it. All right. Here we have a rather particular case when the patient is having her ovary look as such. Well, this happens when the patient is having so what we call an ovarian vesicular mold pregnancy. In vesicular mold pregnancy, the patient will have hormones that are more than the usual in any pregnancy, and so this will make her ovary look as such. Okay, it will be hyperstimulated, but she's not on induction drugs. She's pregnant. She's not on induction drugs, but she would be as if she's on induction. But here the hormones comes from within, from her vesicular mold pregnancy, not from without. Not she's not taking them. Okay, her own body is producing them, the vesicular mold in her uterus, and we will discuss this furtherly in the obstetrics. Okay, so just learn this, that there is an entity named thecal lutein cyst in the ovary when the patient has vesicular mold pregnancy in her uterus. Okay, so this is yet a rather particular case of an ovary with multiple follicles. Okay, these are the association. This is the vesicular wall in her uterus. Okay, again, the vesicular wall in uterus, and this is how her ovaries would look, as if they are under the effect of induction drugs. Okay, so now we have finished the multiple follicles appearance in the ovary. We'll take another entity, what is called ovarian apoplexy. What is ovarian apoplexy? Well, remember the patient who has a cyst? Well, what if the cyst has ruptured, whether it was simple cyst or hemorrhagic cyst? This is what's called the rupture ovarian cyst. The scenario would be as it follows. Well, we have a patient here that suffers from pain in her right or left iliac fossa, and by the ultrasound, we see that she has an adnexal mass, okay, with free fluid. Now, if you see an adnexal mass and free fluid, and patient having acute abdomen, that's to say she's suffering from severe pain in one of her right or left iliac fossa, you might, of course, think of what? An ectopic pregnancy, right? Well, what if she is not married, okay? Do you have any other possibilities? Okay, well, other than questioning her, there is the possibility of rupture ovarian cyst. You might think about this as well. Okay, um, of course, you might send her to have her labs. Okay, and beta HCG. Okay, hormones in her blood, in order to make sure, because this is number one possibility. But there are other possibilities, and that is the rupture ovarian cyst or ovarian apoplexy that would reduce this same triad. Okay, but her hormones would be negative, so there is no pregnancy, but she's having this. So they are similar, but it's less common, yeah, but it does happen. Okay, so let's see how it looks by the ultrasound. This is how it looks with the pathology. Yeah, this is how it looks by the ultrasound. Okay. We have fluid in the pelvis and then an adnexal mass. The adnexal mass looks rather weird. Okay, the adnexal mass looks rather weird. So we're having the ovary, we see it by the follicles, and we have here an irregular shaped cystic lesion, okay? And this is the cyst after it ruptures, and we have here the free fluid, okay? So we might know that she's having a history of cyst, okay? If she does have history of ovarian cyst, this confirms it, okay? All right. So basically, she would have ovarian lesion. This is the ovary. We see it by the follicles, and we have this irregular cystic space, okay, because it ruptured, and we have the free fluid and the pelvis. So this is a ovarian apoplexy. That's to say, rupture ovarian cyst. Okay, again, this is the ovary, has irregular shape, and we have irregular shape cystic space. This is the ovary. Okay, now by the follicles here, and we have irregular cystic space and free fluid. So this is rupture ovarian cyst or ovarian apoplexy. Okay, so in the report, you just merely say that she's having an adnexal mass with free fluid, and you might suggest this is a ruptured ovarian cyst, or for clinical assessment and correlation. Okay, all right. Okay, this is free fluid in the abdomen. This is free float in between the liver and the kidney in the Morrison's pouch. Okay. Free fluid. So it's important to check her abdomen. See the free fluid. Okay. All right. Free fluid. All right. Okay. The ovary. This is the irregular cystic space. Okay. Which represents the cyst that has ruptured. All right. So now to another entity, the para-ovarian cyst. What is a para-ovarian cyst? This means that this is a cyst, but it's not in the ovary. It's adjacent to the ovary. And this cyst, okay, does not follow the criteria of ovarian cyst. Meaning, if we have stated in our report that the patient having a para-ovarian cyst, it's not necessary to place her in one of the criterion states for follow-up. She's the cyst is more than 5 or 7. She's menopausal or not. No. We don't have to say all this because the para-ovarian cyst is essentially benign. So it's important that we, if we find out that this is a para-ovarian cyst, we sit the patient's mind that he is should not need any follow-up or anything, so because the para-ovarian cyst is essentially benign. So the $1 million question here is how to know whether it is ovarian or para-ovarian, since the management really differs. So quite obviously, it's important to know whether it is ovarian or para-ovarian. It's also named the para-ovarian paratubal cyst. Okay, how to know? Let's see. Okay. Um, this is the ovary. Okay, and this is the cyst within the ovary. All right. And this is the ovary. Okay. And this is the cyst adjacent to the ovary. Oh, pardon. There's some overlap here. It should not overlap it. Okay. Just try and consider it is oh, it's the eraser. Okay. Okay, it's easier this way. We'll draw it in. Okay. Now let's have it here. Okay, this is just adjacent. Okay, this is nice. All right. So when the cyst is within the ovary, we would see this ovarian tissue around it. And what is called this part of the ovarian tissue around it, it's called close sign, as if it's opening its close and engulfing the cyst because it's around it. It's essentially ovarian. Or the beak sign, just like the bird's beak, it's opening its mouth and engulfing it. Okay. But here we don't see this claw or beak because the ovary is essentially outside the cyst. We see this angle in between the cyst and the ovary. Okay, so this way, if we can manage to see this claw sign or beak, then it is ovarian. If this is not the case, then this is para ovarian. Okay, let's see it on ultrasound and See how it looks. All right. Okay. Here is a, this is the big sign that's here. Big sign here. This is the ovary pushed by the cyst, and this is the big sign. So this is ovarian. Look at this diagrammatic. Here is the peak, and no, this is not fake. Well, this is a little bit messed up, so let's see about the ultrasound better, because it's not really that clear in this diagram. Okay. Voila. Here, this is the cyst. Okay. And this is the ovary. Okay, this is clear demarcation. And here you can see the angle between them. Okay, so here there is no peak sign or close sign. Okay, there is no ovarian tissue around. This is the essential thing. The point is whether there is ovarian tissue around it or not. Okay, so look at this. This is the ovary. All right. This is the ovary, and you cannot really tell when the ovary ends and the cyst begins because it is inside it, and this is the cyst. So voila, this is the peak. The ovarian tissue is seen around it. This is essentially ovarian. But here, this is the ovary. You can clearly see it. Okay, the ovary is the follicles, and this is the cyst. And between them, this is the angle between them. So this is para-ovarian cyst. Okay? This is how we know whether this is ovarian or para-ovarian. Again, let's draw it. This is the cyst. Okay. Now, where is the ovary? Quite clearly, this is the ovary, as the follicles looks like the ovary. What? And voila, the ovary here is seen around the cyst. It is around it. Okay. You cannot see the whole ovary or trace the outline of the ovary without including the cyst, because it is essentially inside it. So this is an ovarian cyst. Right? Okay, very good. So let's see. Oh, what about this? Huh? You tell me. This is the cyst, and this is the ovary. What is this? This ovarian or para-ovarian? This is ovarian because there is the big sign. Okay, let's remove this and look at this lesion. This is the cyst. Now, where is the ovary? Voila, there's the ovary. Trace it as such. The ovary is beside the cyst, and there is an angle of demarcation in between. So this is a para-ovarian cyst or paratubal cyst. Okay? All right. Again, try to ignore the annotations. We have this cyst and we have this ovary. Okay, what do you think? This is para-ovarian. Yeah. Okay. So there's no annotation here. Think about it. I have the cyst. Now, where is the ovary? Voila, yeah, we have this ovary. Okay, I can fully trace the outline away from the cyst. So this one is para-ovarian. What about this one? If I want to say this is ovarian or not, the ovarian tissue is around it. So this is ovarian, and this is para-ovarian. There is angle of demarcation here, and there is a close here. Okay, and it's a nice one where you can see both. Okay, voila. Yet another example. Look at this one. What do you call this cyst? Do the math. Bravo. This is para-ovarian because here is the ovary. It is wholly located outside this lesion, and I can see some space between them. All right. So this is the para-ovarian, and we've seen many examples of it. Yet another example. This is the ovary, and this is the cyst. So this is para-ovarian cyst. Okay. What about this one? That one. Okay. What about this one? Can you say whether it is outside or not? Okay. All right. This is the ovary, and this is the cyst. So this is a para-ovarian cyst. Okay. All right. So now we have discussed the tumors, the PCO appearance and the PCO syndrome, the stimulated ovary, and the ovarian apoplexy, the ruptured ovarian cyst. Remember, the patient that's having an acute abdomen and free fluid in her abdomen and an abnormal looking cyst in her ovary. All right, so this is the ovarian apoplexy or the ruptured ovarian cyst and the para-ovarian cyst. Now we will discuss yet another entity and the ovary, that is the peritoneal inclusion cyst. What is the peritoneal inclusion cyst? Okay, let's see. Okay, let's see what is this entity. I don't know if you know before or not, but anyway, let's see what it is. If we have here, this is the uterus, and this is the tube, and this is the ovary, or it's with its follicles as such. And this, there's something wrong with this ovary. It is it has inflammation, so it has, sorry, it has fluid around it. Okay. And then there is organization of the flow, and there is fiber inflammation, and there is septic, that is the fibrosis. Okay. And I see this around you. So here there is fluid as such. There's fluid around the ovary. There's adhesions and synechia. So this is a chronic process. Adhesions and synechia. Or we can call septations. So here there is an inflammatory process. There is a PID. Okay, and the ovary has this around. So this is the peritoneal inclusion cyst. Now, how this would look on the ultrasound. Now you see the process. There's fluid, there's adhesions. Okay, how this would look on the ultrasound as such. Okay, this is the ovary. Okay, with its follicles, and I see this free fluid around, and I see this adhesions. I see these three fluid adhesions or septations related to the ovary. Well, this is peritoneal inclusion cyst, part of an inflammatory or infection process. Okay, so it might look quite complicated, but it's basically these three elements. All right, you see this ovary, okay, and adhesions and free fluid. Okay, so ovary related to its adhesions or septations and free fluid. So this means peritoneal inclusion cyst. Okay. All right. Again, there is the ovary, and related to its septations and free fluid. The ovary, we see septations around it, related to it, and free fluid. Voila, this is peritoneal inclusion system. Okay. All right. Again, this is the ovary. There is free fluid around it, and there is septations. So this is peritoneal inclusion system. The patient would have mucositis, would have fever, would have symptoms such, and it's an inflammatory process. And is this common? Yeah, we can see it. All right. Now, we have finished some entities in the ovary, but we're going to delve into a very, very important subject. So I want you to sit back, I want you to concentrate and have this cup of coffee we're talking about. I told you that I'm going to tell you about the mocha pot. The mocha pot mixed the coffee by brewing method when we put the coffee here, okay? The coffee here in this container in the middle part, and we put here water. And the coffee is brewed by the steam of the water. It condenses and it is brewed here in the upper part and produces an excellent kind of coffee, just like the espresso. It's espresso, but it's not really espresso because it's produced by not the same pressure as in a regular coffee machine, but it produces great coffee as well. So I want you to concentrate as if you had this cup of coffee or have your cup of coffee, however you make it. And let's delve into a very, very, very important subject that is an emergency, actually. This is the ovarian torsion. Okay, what is the ovarian torsion? We've mentioned it before, but now we're going to talk about it in details. Okay. All right. All right. Now, we have here an ovary as such with this vesicle. Okay. And what happens is the ovary turns around itself. Why would it do this? Okay. Well, this might be due to it's having a very big lesion. Okay. A very big lesion that makes the ovary turn around itself and reduces this, that is the torsion. Can the ovarian torsion happen without a lesion as such, like big cyst or lesion in the ovary itself or tumor that induces distortion? Can this happen? Well, yeah. So if you see some of the signs here, we're going to discuss without a cyst in the ovary, do not be very astonished. Yeah, can happen. But when the ovary itself has a long pedicle, look at this, when it has a long pedicle. So what happens when it has a long pedicle? This long pedicle might be hypermobile, so it can by itself cause torsion. So yeah, torsion can happen without cyst. Okay, this is what I wanted to emphasize, that torsion can happen without cyst. Okay, as in here, if there is long pedicle or long ovarian ligament. Okay, this is important because do not exclude torsion when the ovary does not have cyst, when you have other reasons to believe that this is torsion. So when does the torsion happen? When there is a big lesion as such, or there is a long ovarian ligament as such that makes it wind around itself. Okay, just like the birthday balloons, that has this twirls around. Okay, when it is too long and turns to turn around itself, well, same appears here, same applies here. Okay, so what I want you to know is that torsion can happen without cyst if it has a long ligament. Let's see how this looks in the ultrasound. Okay, all right. Okay, this is, of course, an emergency. This is a gynecological emergency that necessitates surgical intervention, okay, to salvage the ovary before It dies within 6 hours. So here, when it has the long vertical, this is when it has a big cyst here, and here when it has the long ligaments, okay, that can induces distortion. Okay. Now, what are the signs? Okay. Here, it might happen with no underlying ovarian lesion. Okay, it can happen with no underlying ovarian lesion, but most commonly it will happen when there is an underlying ovarian lesion or due to hypermobility. In both options exist. Of course, it will be more commonly caused by ovarian lesion. Yeah, this is the most common, but you have to know that there are other possibilities as well. Well, in order to diagnose the ovarian torsion, we said that this is very important that you can diagnose it because this is an emergency. You have 6 non-specific signs and 3 specific signs. 3 specific signs, as in you can be dead sure. 6 specific signs that can suggest, along with the clinical data and the clinical picture of the patient, you can suggest it right away as well. First thing, that is the enlarged ovary, and then that it's elsewhere, it's abnormally located, okay? And let's see them one by one, okay? Yeah, but you have to know that there is very important thing that patients, um, alongside with all of these signs, the patient is in pain. She's having a torsion, okay? Yeah. First, then enlarged ovary. Enlarged ovary. Look at this, enlarged ovary. Well, we discussed this before, having the arterial intake, okay? And the first thing that's getting blocked here is the venous drainage, okay? So there will be some flow by the uterine artery. We know that the blood supply to the ovary from the uterine artery and the ovarian artery, this is the ovarian vein. So what will happen is that will be some flow still by the uterine artery, but there is absolutely no drainage. So the ovaries start to enlarge. So the first non-specific sign is that the ovary will enlarge. Okay, enlarged ovary. All right. This is the first enlarged ovary. Enlarged ovary. Now here the ovaries should be on both sides of the uterus. Now the ovaries are on the same side. This is the left ovary, it looks okay, and this is the right ovary. It doesn't look okay, it looks rather heterogeneous and abnormally located. Again, another non-specific sign that there's something wrong with it, not be torsion. Okay. Here, again, this is an abnormal location of the ovary. Okay, you have free fluid here. You have free fluid here. This is the ovary, not free fluid. This is the ovary, and it is very enlarged. You might think that this is the bladder, but this is not the bladder. And this is an important issue. I want you to know that the ovary tends to be rather globular, round as such, whilst the red bladder tends to be rectangular or square, kind of such. And you can ask the patient to be to drink some water in order to make the red bladder enlarge a little bit, so we can distinct both if you're in doubt, because you might think that this is the bladder. Well, this is not the bladder. Only this is her ovary. This is the cyst, and this is the ovary with the cyst, and it is very, very large, and the bladder is small and pushed here. Again, this is, and of course, a cyst as big as such, this is the kind of lesion that would produce torsion. Okay, so again, this is the ovary with the cyst. Look at this, the ovary with the cyst, and this is the urinary bladder pushed to the side. After the patient has drunk some water, the urinary bladder enlarged a little bit, so and this is the uterus. So now I can know that this is a cyst. So the cyst, along with the ovary, would be more globular or round in shape, okay, whilst the bladder would be rather rectangular or square, okay. This is really very important. Voila, this is the cyst. It's circular, and this is looks rather rectangular. Okay, if the river looks such, you might ask her, do you want to bathe if all of this is her bladder? If it's not the case, ask her to drink some water in order to see the bladder. Of course, if it is the bladder, it would, after peeing, it would change in size. So this is just clues in order to make you distinct with entities from each other. Okay, and the thing that make you suspect is that this doesn't look like the bladder. Okay. Okay, so here is this cyst or bladder? Well, this is a cyst because it looks rather globular or rather round. All right. So we said that there are non-specific signs as the enlarged ovary and abnormal located, and then the ovarian stroma would look androgynous. Okay, you can no longer see the ovary stroma and the follicles, and you can see the lesion. Okay, the cyst. Look at this. This is the heterogeneous appearance of the ovary alongside with this being enlarged. Okay. All right. Might see cyst as well. Look at this. The follicles are pushed to the side, and it has heterogeneous architecture here. Of course, this is not PCO because the two clinical settings are very, very different. This is the patient that's having pain, and perhaps she's having tender by the probe as well. Okay, so this is not the scenario of PCO. This is the enlarged ovary with the heterogeneous stroma. The follicles are pushed to the side. The patient having symptoms. She's having pain. And you can see as well a lesion in the ovary. You can see this big cyst in the ovary. Okay. This is to one of the non-specific signs, because this is the cause. Will make it twirl around itself. Again, this is the ovary. Okay. Some follicles here pushed to the side, and we have this huge cyst within. Of course, you can say that this is ovarian because, voila, this is the peak sign. This is the ovarian tissue around the cyst. So this is an ovarian, a huge ovarian cyst. Okay, this is one of the non-specific signs. So there are two signs. The ovary itself would be large and atypical in location, and then the heterogeneous look of the ovary, and the lesion in the ovary that is a cyst in the ovary. Okay. So we have now 4 non-specific signs. Look at this, cyst in the ovary and some follicles. Okay. All right. So in this case, you'll write that this patient suffering from tenderness by the probe, and she's having an ovarian cyst. Okay, and there might be an underlying torsion, even if you don't see the signs of torsion, but her having a big cyst along with tenderness by the rope or clinical symptoms in acute abdomen, there might be an underlying torsion, you cannot see it. Just raise the clinical suspicion and tell the clinician it might be the case. Okay, and her having a ovarian lesion along with the signs. Okay. Okay. Then the free fluid, the tenderness by the rope. Okay, she cannot tolerate the rope and the free fluid. Okay, these are very important. Okay, signs, and you have to know them in order to salvage the ovary, as we said, by within 6 hours. So what are the signs? The enlarged ovary, the enlarged ovary, enlarged ovary, the abnormal location, the ovarian stroma would be heterogeneous, might be a cyst or lesion, tenderness by the root cannot tolerate it, and the free fluid. Okay, now let's move on to the rather specific symptoms you can see. All right, we have 3 specific symptoms. This is the free fluid, free fluid. This is the uterus that's enlarged and rather heterogeneous, and the follicles are here arranged peripherally. Okay. Now, the 3 specific signs. The whirlpool sign, we said that if it's spherical, it turns around itself. Can you see it by the ultrasound? You'll see in a few seconds. And the abnormal Doppler flow and the follicular ring sign. Let's say them one by one. Okay. If we see one of these, we will be dead sure. Now, this is the pedicle of the uterus, of the ovary, and it turned around itself using this whirlpool sign, twisted. This is by the pathology, real pathology, and this is by the ultrasound. Now, of course, we can see it better by turning on the Doppler. I will see the vessels twirling around itself, twirling like this. Okay, like spiral, twirling on itself. Look at this. This is by the B mode only. This is it. Now you can see that there are something spiraling around itself, but of course by the Doppler you can see it much clearer. Okay, because of course the pedicle contains the vessels, and we can see the vessels more highlighted by the Doppler. Okay, this is okay. This. All right. Okay, this is a video. Let's see it. Okay, this is the spiraling vessels around itself by the B mode. Now we will have the Doppler on, spectral Doppler, that will make it look much clearer. And voila, this is the Doppler. See how it looks. Okay, so it's more clear now. Okay. Again, this is now the whirlpool sign. This is a sure sign that there is, looks like the target sign, yeah, that there is a torsion. Now to the Doppler sign findings. Okay, we've mentioned it before. Now let's have it more of these details. What we have here is an ovary as such. Now remember the blood supply that we've discussed before. We said that there is a branch from the uterine and branch from the ovarian. Now the main blood supply would be the ovarian, so let's say it receives like 10 from the ovarian and 5 from the uterine. The main would be from the ovarian and has the venous drainage, the ovarian vein. What will happen is that the pedicle here is torsion. We have here torsion, it is blocked. So there would be blood supply from the uterine, okay, at first. So the ovary will enlarge because there is no drainage. It would start to enlarge. And in phase 1, we will have enlarged ovary, okay? But there would be some flow inside from the uterine artery. So it will be arterial flow, okay? All right, then in phase 2, what will happen? The ovary will continue to enlarge, continue to enlarge, okay? So even the blood supply from the uterine will be blocked as well, and the ovary will be too large as such. So it would be enlarged uterus, enlarged ovary with no vascular flow at all. here the torsion is complete. Okay, so here there is a torsion, yeah, but with preserved flow in phase 1, preserved arterial, not venous, arterial flow. And in phase 2, there will be no vascular flow at all. So can there be torsion with vascular flow inside? Yeah, some arterial flow in phase 1. So this can happen. And of course, if there is no vascular flow, yeah, this is torsion. All right. So let's see this by the ultrasound. Okay. Want you to know is that there can be torsion with some vascular flow inside, namely the arterial flow in phase 1. So there is no flow inside. Yeah. Here there is no flow whatsoever. And the ovary is enlarged and heterogeneous, and there is no flow whatsoever. Okay. This is torsion. All right. Here. This enlarged heterogeneous ovary. Okay. There is a cyst here. There is no vascular flow inside. Okay. All right. Okay. And the patient is having pain. So this confirms it. All right. Remember, the clinical is very important. Here there is different in vascularity. Okay. Between the right and the left. Here, see that this is the right ovary and this is the left ovary. In the right ovary, we can see both arterial flow and venous flow. So there is no torsion here. But look at this. There is here arterial flow. Does this exclude torsion? No, because there is no venous flow. There is no venous drainage. So this is ovarian torsion, okay, in its primary phase. Okay. Yeah. All right. Although this one has the cyst, but this one that has the torsion. Okay. And it would be supported by her having pain in her left iliac fossa. Then voila. This confirms it. Patient must have clinical symptoms. Okay. Along with these ultrasound sign, of course, the Doppler findings is specific. The ovary being enlarged, being heterogeneous, all this is non-specific. But along with the clinical data, it can be, I can readily suggest this is torsion. Now to the last specific sign, this is the follicular ring sign. You can see that there is here, these are the follicles. You can see no wall to these follicles. There isn't a perceptible wall to these follicles. Look at these, as if they are drawn here. You can see that there are wall around them. There are wall, there's perceptible wall. This is a specific sign too to the ovarian torsion. The third and last specific sign that there is an ovarian torsion. Okay. This is called a follicular ring sign. Okay. This is follicular ring sign, and you can see the cyst here. All right. Follicular ring sign, heterogeneous ovary, enlarged, patients having pain, free fluid in the abdomen. Voila. This is torsion. Follicular ring sign, torsion. Okay, it's very specific sign again. Follicular ring sign and this torsion. Okay, so let's wrap them together. What are the signs of the torsion? We have 6 non-specific signs and 3 specific signs. Let's cite them together. Okay. The non-specific signs were enlarged ovary. Okay. Abnormally located. Okay. 2 things inside. echo texture abnormal, heterogeneous, lesion inside it as in cysts, the free fluid, and her having tenderness. Very important. Okay, what about the 3 specific signs? One, that is the verbal sign or target sign, the abnormal Doppler, that is abnormal Doppler that is absent vascular flow, or it is the primary phase, there is arterial flow only. And lastly, the follicular ring sign. So these are the signs. These are the specific ones, and these are the non-specific ones for the torsion. This is, of course, very important as this emergency. Now you can take your breath. Take a very deep breath. We've finished, and we take a nice quiz. Try to test yourself and see how much right you get. Okay, let's start. How about this one? This is rather specific. This is dermoid. Bravo. Give yourself a note for every correct one. I'm sure you get so many. Okay. What we see here? We see here an ovary. Ovary with its follicles as such, and some free fluid, and a septum for adhesions. This means, bravo, a peritoneal inclusion cyst. Okay. Next. I see an ovary here. This is an ovary. And inside it, I see this, okay, this lesion that has a vascular ring around. This is the corpus luteum with ring of fire. Okay. Okay. What about this? This is an ovarian lesion and it is gray. It is an endometrium. Bravo. What about this? This is an ovary that's large. It has this small follicles arranged around the periphery. Yeah, you are right. This is a PCO. Bravo. PCO appearance. It would be syndrome if she's having symptoms like hirsutism or oligomenorrhea. What about this? This is an ovarian lesion with a fluid level, or you can see an echogenic part in the upper part. Bravo. This is a dermoid cyst with fat floats. What about this ovarian lesion? Is it ovarian or not? Okay. Yeah, I can see this cyst, and this is the ovary. Para-ovary. Bravo. Okay. All right. I can see this lesion. It's ovarian, and it has septum inside, and there is vascular flow inside. Also not the wings. Tell me your full comment. Think about it for a second. Don't forget this. Okay, this is an ovarian lesion. Okay. This is an ovarian tumor. Yeah, because it has vascular flow inside. And since it has this septum, I would rather say that this is multiloculated. That's the same mucinous adenoma, cystadenoma, or cystadenocarcinoma. Would you weigh one against the other? Yeah, this is rather malignant or adenocarcinoma because the resistive index here is rather low, less than 0.5, and you see that the systole and the diastole rather close to each other. So this is weighs more the being malignant rather than benign. Bravo. Excellent. Okay. What about this one? You see this ovarian lesion? It has this white echogenic part. So this is a dermoid cyst. Bravo. What about this? This is an ovarian lesion This is an ovary that has multiple follicles, and the patient is on induction drugs. Yeah, this is a hyperstimulated ovary. What about this? This is an ovarian lesion, and I see this calcific um, part that has posterior shadowing. Yeah, this is one of the appearances of the white cyst. Bravo. What about this? Yeah, the ovary is in abnormal location. It looks heterogeneous, and the patient having pain. So this is a ovarian torsion. Okay. What about this is an ovarian lesion, and I see vascular flow inside, and it looks like soft tissue. Huh. So this is, yeah, this is an ovarian tumor because I see vascular flow inside. Since it has a part that is like soft tissue part inside, I would rather say that this is serous cystadenoma or cystadenocarcinoma. Okay. What about this is an ovarian lesion, cystic lesion, and there is no vascular flow inside. You would say that this is, yeah, this is a hemorrhagic cyst. What about this lesion? It's ovarian lesion, okay, and has this fluid level, and this dark part, the darker part tends to be gray. So this is an endometrial. Bravo. What about this? Mm, yeah, okay. Okay, this ovary has multiple follicles, and I tell you that this patient's having 17 years, huh? So this is, yeah, this is a multifollicular ovary. Bravo. Hmm. What about this? What about this? Hmm. Okay. I want you to tell me the name of the sign. Look at the follicles. Yeah, this is the follicular ring sign. And the patient's having pain on the left side. So she's having a torsion. Okay. Now let's see other cases other than ovarian. I have this uterus here. Okay, and this is the endometrium, and I see this lesion. This is, yeah, bravo. This is an endometrial polyp. Okay, next. Hmm. This is a hysterosalpingography, and I had to inject the patient twice. So this is clearly a case of diadelphys. You know, look at this one. Look at the cavity is like this from the outside, and the endometrial cavity is like this. So this is a septate. Looks like heart from within. Okay, look at this one. Look at this one. This is from the outside, and the cavity within the endometrium is heart-shaped as well. So this is heart from the outside and heart from the inside. So this is a bicornuate uterus. Okay, so this is the difference. There we are. The septate is hot from, it looks like hot from within only, but this one looks hard within and without, externally and internally in the endometrium. So this is a bicornuate uterus. Okay. What about this? Huh? Is this a lesion? No, this is merely posterior enhancement. Okay, bravo. What about this hypoechoic lesion? This is a fibroid. Bravo. In contrast with the polyp seen before, the polyp looks hyperechoic. This is hypoechoic. Bravo. Okay. What about this? The uterus here looks coarse and heterogeneous. You cannot discriminate endometrium from myometrium. This is an adenomyosis. Bravo. What about this? Here, the endometrial thickness is enlarged. It's like 21, and this patient is middle-aged female. So what I would tell her, this is an increased endometrial thickness for differential diagnosis. Yeah, because it might be caused by pregnancy, hyperplasia, exaggerated security phase, or so this is for follow-up and DNC layer. Okay, great. What about this? If I tell you that this patient has fever and mucositis and she has these shadows in her uterus, so this is an endometritis. Bravo. This is a case of infertility, secondary infertility. So this patient has this regular endometrial cavity. She has synecdoche and adhesions. Look at this ID. Huh. Is this in its place? No, it's low lying. It's in fact in the pelvis. I'm sorry, in the cervix. It is displaced. Look at this ID. Is it merely low lying or there's something else? Yeah, it is embedded in the myometrium. Has to be removed. Okay. All right. What about the next one? See the cystic spaces, the subendometrial cyst. This is an adenomyosis. What about this? This is a cyst in the ovary. It has this soft tissue shadow inside, but there is no vascular flow inside. So this is a tumor? No. As there is no vascular flow in this part, it will be considered as a clot, and this is a hemorrhagic cyst, so long as there is no vascular flow inside. The last question, what about this? This is a uterus with unicornate uterus and rudimentary functioning horn. That was all. I hope that you've got good notes in the quiz, and thank you for listening.